KNSS, and a special guest this morning, Senator Dr. Roger Marshall with us. Good morning, sir.
Steve and Ted, it's great to be back with you live in person. I'm telling you, that's one of the hardest-hitting, quick, action-packed news summaries I've heard in a long time. That's amazing.
We don't fool around.
No. I listened to that, and it is so good that you hit so many highlights of what I hear from people, and one of it is my nurses, concerned about the nurses, that the dangers that they're exposed to today. Of course, my wife, a nurse, practiced medicine here in Wichita as a medical student, so there's this mental health epidemic, and that's exploding in our emergency rooms. Our nurses feel threatened. They're overworked. They're underpaid. And, my heart goes out to my nurses, such special people.
Well, and I think, what was it, yesterday or the day before, there was Nurses Day. Maybe it was last week, but we were just honoring all nurses everywhere. And I have a close relative who practiced nursing for, 15, 20 years, and then she just bailed out and went to do something else. You couldn't stand it anymore. There's a lot of stress in that, isn't it?
Lots of stress. Bernie Sanders and I are having this conversation in D.C. Believe it or not, Bernie and I have a very close relationship, and one of our big concerns is workforce, that we're losing so many nurses and doctors. They're just overwhelmed with because they become data entry personnel. The government is smothering us. We're not being rewarded. The government's been cutting pays for doctors for the last 4 or 5 years as well. And again, we just all went through this COVID epidemic. They were overworked and underpaid, and it's challenging times.
Well, and I've seen it. My wife and I, she's gone through a shoulder surgery, and I've seen it over the past couple of years. I mean, the doctor, first of all, he's got a laptop with him wherever he goes because there's a lot of data you got to keep track of. And then, can we do this procedure? We'll have to call the insurance company and find out. I mean, I think that you got a good point. I think that medical deal, there are a lot of things that could be cleaned up.
Another legislation that Bernie and I are working on is called the prior authorization legislation. So like you said, if you need your knee replaced, you got to call the insurance company and ask them if it's okay. And then they delay you. So what we're working on is a uniform electronic package. The doctor can say, we've done this, and this. It's a very common procedure, and it should be done electronically rather than this delay game.
Yeah.
Well, I like the fact that you said the word uniform, because it seems like people get into these situations and it's so complicated and tricky and people just get overwhelmed. And that just extends to everything that's medically happening to them.
Exactly. And really what's happening, especially we're seeing it with Medicare Advantage programs, their trick is to delay care. They ask for one thing from the doctor's office, you give it to them, and then say, okay, now we wait to 2 weeks to get back with you. Now we want something else as well. Next thing you know, 3 months have passed by, and this person that needed a knee replaced, now they're addicted to codeine. So we had the tail wagging the dog.
Oh, you're very safe, because that's just the thing that we have run in our house. But run into, my wife is the one who gets on the phone, and she has a linebacker personality. No, I'm going to stay here as long as I have to. It goes on hold for an hour and a half.
Yeah,
she'll stay. So if most people give up,
Exactly, and that's what's happening in our doctor's offices. The doctors and nurses are being put on hold.
And as you know, the main thing for any doctor is what is that bedside manner. And if you're all stressed out, it can impact the way you treat your patients sometimes, I'll bet. But that's crucial to healing, isn't it?
Absolutely. The relationship between the doctor and the patient, the nurse and the patient, is absolutely the most important element of good healing.
All right, we talk about the economy anytime. We talk about here in Kansas, talk about the farm, what's going on out there. Oh, we had some terrible drought and a terrible wheat crop this year. And you're involved in a farm bill right now, right?
Right. So every 5 years we write a farm bill.
It's every 5 years.
Every 5 years. This is the year that we're doing it. And while it's a farm bill, 90% of the monies are for food and nutrition. So I was at Derby Middle School yesterday. They fed 200 kids. Every day in the state of Kansas, we feed about 200,000 meals a day from USDA funding. So think about school meals. Think about the senior center I'm going to over lunch today in Andover. Think about the WIC programs. Think about food banks as well. I'm going to go to the Cargill Food Bank later today, their distribution center. So 90% of a farm bill is for nutrition programs, 5% to the farmers. And for a year like this, that crop insurance is so important. We had to plow under a third of the Kansas wheat crop because of this, the worst drought since we've had since 1917.
Wow. Yeah, and it's felt throughout the economy. Those farmers, I don't admire them. They have a tough road, and But what you say is so interesting because also people talk about a farm bill. They don't realize how much of that money that's spent there goes not to farmers, but to people who get the stuff from the farms, the people who are eating things.
Right, and probably the biggest challenge we face for the farm bill is paying for it. So just like groceries are up at your house, groceries are up for the federal government. So groceries are up actually about 75% when it comes to how many more people we're feeding because of a bad economy. We're feeding more people, and then the groceries have went up. We had budgeted about $70 billion a year. We're spending $140 billion a year on nutrition programs right now. And here we're set at the federal government that's borrowed, that owes $32 trillion. We're paying $650 billion of interest, and I'm trying to figure out where's the money going to come from. But there's such good programs, we'll do our best.
All right. Well, listen, before we let you go, because I know you need to get in your air-conditioned car and get out of here, but the 4th of July is coming up. We call it Independence Day. You got any message for your citizens out there, the taxpayers, about Independence Day? What do you think?
Yeah, what a special day. I would ask your listeners, are you a patriot? When did you become a patriot? I became a patriot when I went to do my officer's basic training at Fort Belvoir, Virginia. I was a second-year medical student. We had a 3-month-old baby daughter with us, our first child, and we spent the summer there. And whenever we had a chance, we would go spend a day at Mount Vernon, or a day at Monticello, or a day, at different museums. And that's when I realized the sacrifice that was made. These people that sacrificed their fortunes, their lives. The people paid a great price for this freedom. I hope we earn it. I hope we stop and just recognize we still live in the greatest country in the world. Still proud to stand for the flag, salute the flag as well. So have a great time. It's a great family moment.
And my son, who's retired Air Force now, he was deployed in several places on other parts of the world. And he says, Dad, if these people in America, if you could only see what I've seen, you would know we have a real good thing going here compared to other places in the world.
And that's one of the things, too, is that you talked about the people that gave the ultimate sacrifice and thinking about things like that. We weren't fighting for a president. We weren't fighting for a king. We were fighting for an idea. And
right.
That's what's been a wonderful thing at America's core for more than 200 years.
Yeah, we take an oath to the Constitution.
Yep.
I served. My dad served in the Air Force, brother in the Air Force. My son is now serving in the Army as well.
Wow.
Uncles, great-uncles, even had some great-great-grandfathers served in the Union for the Civil War. So I think that those of us who have served feel that the American flag is a very special place and should be honored. And again, as we're lighting those fireworks, let's remember we're celebrating America's birth.